Between 1999 and 2008, 31 outbreaks of patient infections during endoscopy were reported. During the last period of time, an increasing number of hospital infections with multi-resistant germs, spores, viruses and others has been published, not to speak about the unsolved problems of prions. The first symptoms of a virus infection, for example, is often an unspecific flu-like presentation. This symptom may resolve in many cases without the cause being diagnosed. When 7 to 20 years later the symptoms of the disease appear, no one will think to ask the question, did you have had an endoscopic procedure 7 to 20 years ago? The results of the HYGEA study in 2002 have demonstrated that after specific instruction in professional cleaning, 37% of the endoscopes were still contaminated. The contamination was located in the channel system and at the albumin level. The smooth outer surface was not the problem because it is easy to access and to clean. Investigations of repossessed endoscopes with integrated channel system demonstrate damages on the surface of the plastic material which have infection risks. Our own experimental work has shown that this process initiates already one day after inserting a plastic tube in a digestive ambience like the esophagus. It begins on the surface with the biofilm formation, mention the arrows, and is followed by fungus colonization. Little later, bacteria and amorphous food particles can be detected in the candida and bacteria network of the fungi culture. The deposits grow on and in the plastic material. The increasing crust formation has a high risk to become a breeding ground for multi-resistant germs, bacteria, fungi, spores, viruses and other. The surface of the channel system of new endoscopes is not smooth. There are small indentations and irregularities at the connections between different parts of the channel. These are the regions where tissue and blood are caught and remain even after cleaning. When the channel system of a clean endoscope are viewed with very thin fibers, it shows images of dirty channels. Blood in the channel, especially in its irregular areas, can be seen. These areas of irregularity have an increased risk of contamination and are virtually impossible to clean properly. After reprocessing of the working channel, the surface of the brush sheet is visible. Tissue remnants remain after brush cleaning not only at the irregularities of the channel system. The dirty reprocessed working channel before and after the biopsy forceps was introduced. In this way, the tip of the forceps can take contaminated material to the mucosa and inoculate it during the biopsy. Abre, chiude, sì, e vai fuori. Sì. To avoid contaminations, a disposable system is at our disposition. Finally, the disposable system is retracted. The system is disconnected from the endoscope and discarded. No contamination or infection is possible. Once the procedure is finished, the solid endoscope can easily be cleaned and disinfected. In conclusion, use sterile disposable tube systems and sterile disposable instruments.